We've all heard them. Starve a fever, feed a cold, get lots of vitamin C, don't go outside with wet hair. But what should you really believe when it comes to the common cold? We sat down with two primary care physicians who helped us separate fact from myth to find out. Dr. Rebecca Waters with Community Primary Care Shaw says patients often come to her with how they think they got sick.
I wasn't wearing socks and I walked on the cold floor and that's why I got sick. Going outside with wet hair is a very common thought. There's really no scientific evidence to back that up.
The real cause of the common cold, Dr. Waters says, are germs.
We know what causes illnesses, viruses, bacteria, actual infections. They don't exist more in the cold. They don't affect you because you're cold.
As for starving a fever,
if you're ever sick with a fever or otherwise, you should never starve. Just having a general balanced diet. It's really important if you are sick to keep up with your nutrition and your fluid intake.
Dr. Peter Bong with Copeland Medical Healthcare Partners says to be careful when it comes to vitamins and supplements.
So vitamins can definitely prevent and treat illnesses. They're primarily used to supplement, which means to be of added benefit to what you're already doing. In terms of a multivitamin that will prevent disease, there is no indication actually for that.
Both doctors say a consistent healthy diet is one of the best preventative measures you can take to keep from getting sick.
So no specific kind of diet, just general healthy things. So lots of fruits and vegetables, whole grains, lean proteins, chicken and fish.
And finding a primary care physician is key.
So the role of a primary care physician is to really be the quarterback. We're the ones who are triaging what is emergent, what is urgent, and what can be treated with some time.
So from a young age, I have enjoyed helping people in general. I have close relatives who have always needed doctors, had medical problems, and it's just the most fulfilling thing, being able to be there for somebody that needs help and you actually might have some answers. I don't always have the answers, but I love being with patients through the highs and lows of life, help navigating their health with them. So primary care is basically the blanket statement for you're the first doctor to kind of address any main problem. We address all organ systems as primary care doctors. Internal medicine is more of I look at it like an adult pediatrician. So we specialize in adult medicine. Our training was a little bit more specialized in acutely ill patients. We spend a lot of time in the hospital.